Good afternoon. Welcome to our March virtual support group meeting. I request our Vice President, Amy Dukovic, to continue with the meeting. Thank you, Amy.
Welcome, everybody. Happy Sunday. Today, it is my pleasure to introduce a very, very special speaker, Chapter 94's own Karen Bertozzi. She is going to first share with you her heart journey and then show us how she has taken her favorite activity, yoga, and has learned to adapt it for cardiac patients. You're welcome to join in. Here we go. Karen, take it away.
My name is Karen, as we mentioned before. My heart story, about 6.5 years ago, let me backtrack. I've been a certified yoga instructor for over 15 years. 6.5 years ago, it was a Thursday. I taught 2 classes and I went to a local supermarket like I always did on a Thursday to get sushi for lunch. I didn't make it to the sushi bar. I ended up passing out right in produce. And I passed out and 4 days later woke up at Suburban Hospital with a thoracic cardiovascular surgeon and my husband telling me that I had undergone a 12-hour emergency open heart surgery for an ascending aortic aneurysm with dissection. And I had an 18-day ICU stay and I was sent home with a dual lead pacemaker. I'm 100% paced. So in a nutshell, that's my story. The interesting thing about it, I think, is moving into it, I didn't really fit sort of the framework of what those patients look like. I was 46 when it happened, very fit, very clean diet, never had high cholesterol, never had high blood pressure. All my boxes were checked. But unknown to me and my family, we had a connective tissue disease moving through our family. And it was my event that really kicked off a whole series. It was a little bit like Pandora's box, you know, the whole thing started to unravel. So my event happened in October. My 3 siblings were scanned in December, 2 months later. All of them presented with aortic aneurysms. 2 went on to have elective surgery. 1 lost his life. And another brother has yet to do anything, yet. We're watching and waiting, nervously watching and waiting. So it was quite a big event for our family. October is always met with this whole sense of fear and sadness and loss, and then also with this knowledge, right? And that's sort of been my platform moving forward, is knowledge is power for all of us. In terms of your healthcare, knowing, what's happened in your family over the years and that sort of thing. So I'm a big advocate of not only knowing your numbers, but if you have somebody that maybe died fairly young in your family, go back and try to connect the dots. But all of us know that because we've obviously had some type of experience that has brought us here together. So back to my surgery, so I think everybody knows what an aneurysm is, right? It's just the swelling of the aorta, almost like a water balloon or almost like a garden hose that has a kink in it, right? It starts to swell to the point of rupture. So they basically cut that section of my arch out, replaced it with a Dacron graft. My aortic valve was repaired. I didn't have to deal with replacing it or making any decisions. Down the road, maybe I will have to. So repaired, not replaced. Arch is completely Dacron. The dissection, what happens with the dissection, and again, I know I'm talking to other heart people, but your aorta is a tube that comes off your heart that helps to deliver oxygenated blood to the rest of your body, right? So your aorta starts to go up this way, and then it also feeds down into your kidneys and into vital organs. What happens in a dissection is the layers start to shred apart. You have something called false lumens or channels where maybe too much blood is flowing in one direction and not enough blood is flowing in the other direction. It can lead to death, it can lead to stroke, it can lead to organ failure, and on and on and on. So lucky me, on that day, I had an aneurysm and I had a dissection come together. So, and then, my stay in the ICU, I struggled with infection. I struggled with pacing issues. I remember on Halloween, my surgeon and electrophysiologist came in and said, "We know how to get your heart paced properly. You're going to need a pacemaker." And at that point, maybe like all of you, maybe you can relate to this, you kind of let it go. Whatever needs to happen, right? You give it up to science, you give it up to the doctors that have taken such good care of you. And I feel very blessed to have a pacemaker. It gives me a lot of confidence, and it is what it is. So in a nutshell, that is my medical story. I feel great. So again, this event happened 6.5 years ago. Roughly a year post-op, it came to my attention that there was such a thing as cardiac medical yoga. It really wasn't on my radar. In the time that I studied yoga, I have a lot of, prenatal certification, addiction certification. I have different little certifications, but I never knew that cardiac yoga was a thing. And it was brought to my attention that actually this woman at UVA, who, a couple hours away from here, actually created the program in conjunction with the help of Dr. Dean Ornish. I'm sure all of you kind of know him as sort of a guru, a California guru, who, not guru in the sense of yoga, but somebody who first brought sort of preventative stuff that we can do in our lives to help our heart health and our cardiac health. And so it's taught, the program, back to the cardiac medical yoga program at UVA, it's taught by a PhD. It was basically 100-hour long training, and it was incredible, really, really great. And again, I did this down in Charlottesville about 5 years ago, and I was fortunate enough to have connections at Suburban, because I had been very active as a Mended Heart volunteer and as a patient, that we were, just kind of, it opened the door and I was able to start the program there. And it's been really great. And I mean, it's been a challenging year for all of us, but Nancy G, who's here, is one of my regular students, and we do fairly well, I think, in terms of technology. I think everybody walks away very satisfied, and the sense of coming together and being in a community and sharing is still happening for us twice a week. The class is just an hour long. The postures are in a chair, or they are using a chair when you're standing, and we do get down on the floor and stay on the floor. So some of the restrictions that I have personally as a heart patient in terms of exercise, I honor in my class as well. And of course, all of us have different restrictions. I have to be careful about dropping my head below my heart. I have to be careful about isometric pressure forming, especially in my aorta. My heart rate is not supposed to go above 150, but in a yoga class, it probably wouldn't anyway. And my pacemaker keeps that in check. So there are restrictions, but I think what I've learned both in doing the training and teaching the class over these past few years, there's a lot we can do. And I came from a place of being very, very athletic, and the stretches and the breathing and the awareness that we do in a cardiac medical yoga class are very important and are very, very useful tools in managing stress and also just feeling better, right? It's very much just about resetting your posture, being nice and tall. I tell students as they come into a class, this is an old slinky. I'm sure you guys have seen these before, but my guess, as you come into an evening class at 5:30, you're compressed, you're out of whack. My goal is that when you leave the class, you feel like this, right? So it's very much about creating space in the body, especially in the spine, because that's where all your nerves really connect into, right? And it's very much about settling the parasympathetic nervous system. And I don't want to get too medical, but the parasympathetic nervous system gets heightened. It creates stress in the body. And that's where adrenaline kicks in. That's where anxiety starts to kick in. That's where your head starts to get into the game a little bit. So especially in cardiac medical yoga, we're very much working on stimulating the vagus nerve. And again, I don't want to get too medical, to help regulate the stress hormones in the body, right? So things like cortisol, adrenaline, especially those of us that are heart patients. There's a reason why a lot of us end up as heart patients, right? We maybe don't regulate or even know that we're under stress. So I think it's a very good way to just check in and start to learn some skills to settle the nervous system, right? And we do that through breathing, we do that through movement, and we do that through awareness. The program, again, the program that I went through at UVA, you know, I learned a lot about medications. It was really unique having been a heart patient and then having gone through the program. It was very unique. A lot of the future teachers that are drawn to the program are some of our exercise physiologists that end up in cardiac rehab, some of our cardiac nurses. I know in the past few years, because I've sort of helped to assistant teach the trainers, or the trainees, I should say, I'm in a pretty unique situation because I know what it feels like to be a yoga teacher, and I know what it feels like to be a heart patient. So it's really, I think, an interesting combination that I can bring to the table because, you know, much like you guys and gals, I know what it feels like to have chest tubes. I know on amiodarone. I know what it feels like to be on valsartan. I know what it's like to be on a statin, right? I know all of that. I know how hard it is to breathe after surgery. I know how I feel of my sternum even now, right? I still, and heart patients, you know, we tend to hunch over, close off, and protect. So another thing we need to do, especially with yoga, is to open up, stretch, so we can breathe more, just more easily, right? You can get more oxygen into the body, which is what we need, not only for our physical body, but again, for the parasympathetic nervous system, just to let it drop into a nice balanced place. So the teaching, the training that I have done, we go over postures, we go over alignment, we go over heart conditions, we go over medications. We talk about how movement changes our blood pressure, right? And I know probably most of you, you get up too fast and you get dizzy, right? That happens to me all the time. It happened this morning. I was cooking and cleaning and I got to catch myself. Orthostatic hypotension, right? So as soon as you pop up too fast, you're dizzy. Well, we can help kind of train your body so that you breathe, you inhale when you move from low to high, right? It takes your mind off any idea that you're going to get dizzy, settles the nervous system, and brings oxygen into the body that you need. Again, inhale as you move from low to high. So little things like that I think are really useful for us. And you know, I would just encourage you all to give it a try. I mean, again, it can benefit anyone in the population. And my class that I teach, again, it's twice a week. It's Monday nights and Thursday nights. Our class has really grown to not just cardiac patients, but we have cancer survivors, we have knee and hip replacement people in there, we have behavioral health people in there, we've got caregivers, a lot of couples come. We have, let's see, what else do we have? I said cancer survivors. Anyway, my point is it's pulling a lot of people in. It's not just heart related. And especially during COVID, it's been a really nice situation. People are getting more and more comfortable Zooming. And I guess you guys are comfortable Zooming because you're here this afternoon. But it really is a highlight of my week. I'm missing visiting patients in person desperately. I'm very much looking forward to that. But this has at least allowed me to be in touch with you guys, make new friends, and try to assist other heart patients in a different way, right? So it's been a really great study for me. It's been a great resource for me. It's been a great way to combine my past in terms of teaching yoga and working in fitness to my heart event, kind of pulling them together so that I can hopefully inspire and get people moving, right? We got to move. Anybody have any questions, basic questions about anything I've said so far, whether it's my heart story or some of the initial stuff I've suggested about the cardiac medical yoga? We can be as informal as you all want to be if anybody has a question.
Yeah. And folks, just unmute. If you want to ask, just unmute yourself and ask Karen anything you want to know.
Nobody needs to know anything. All right. So we can just start moving. So I invite you all to get comfortable. And again, if you do not want to be on the video, go ahead and do stop video in the bottom left-hand corner. It would be nice if some of you stayed though. So I'm just going to put you through really simple paces, Be careful with twisting. That's one thing. I know there's a couple other aorta patients here in the group with us. We need to be really mindful about twisting, right? When we twist our spines, potentially isometric pressure can be increased. So be really mindful. That's one thing I try to not push too far, right? You want to be at that place where you're getting the benefits of the posture without risking anything, especially for us. So be real careful about that. If anything I'm doing is not your cup of tea, just take a pause, maybe listen and watch, and then jump back in when you're ready. We're just going to move a little bit, you know, not too much. We'll move for maybe 20 minutes or so, I'm guessing, Amy, or we'll see how it goes. And just kind of get some space in the spine, see how your breath is tonight, or this afternoon, I should say. And let's just see where things are. That's one of the first things really about yoga is learning how to accept where you are today, this afternoon at 3:17 on Sunday. So somebody like me, I cannot compare myself, and I bet all of you can relate to this. It's not fair to compare myself to what I could do 10 years ago or 5 years ago. Well, I can do more now than I could do 5 years ago, but you understand my point. It's very much about sort of being and learning to accept ourselves where we are today. Maybe you're feeling the time change. Maybe you're feeling the pollen. That's okay. It's okay. And it's really about being present. I know you've heard it. It's a loaded saying, being in the present moment, right? We can't do anything about the past. The future's not here yet. So we're really right here in this space. So let's just do a little bit of stretching, a little bit of warm up. Get comfortable wherever you are. It doesn't matter to me if you're seated on the floor, if you're seated on a chair, if you're seated on your couch, it doesn't matter to me. All right, Brian, you good? Thumbs up. Can you hear me? Awesome, awesome, awesome. All right, you guys, good. So just get comfortable. We'll start by closing the eyes. Let your hands just rest easy in your lap. Close your eyes. That's all I want you to do. Just close your eyes. All right, so for a lot of people, this is almost the most difficult posture we do in any type of yoga class, right? You're shutting off the senses, you're going internal, you're sensing your breath and just being. And again, sometimes this is the hardest posture of the whole class. And so as you're here, just start to notice your body. Notice any areas of tension, tightness, soreness, fatigue, injury, and you're just noticing it, right? It's not about changing it. It's not about that at all. It's just about noticing, right? So for me, I always share this with my students. It's my lower back and my right hip. So right away, I start to think about that connection of my mind to that part of my physical body. That's where my aches and pains always are. And just check in with your posture, right? I would like for you to feel your tailbone reaching long, your belly is pulling in just a little bit, your chest and your heart, they lift, your shoulders drop and the crown of your head rises. It's almost like you have a hook or a string in the crown of your head and you're gently being pulled skyward. Good. And you should start to feel your spine getting taller, longer, and more open. Good, so we're moving to the breath now. The breath can be tricky for those of us that are cardiac patients. We're not trying to fix anything, we are noticing it, and that's all. Our first few rounds of breath, here are the instructions. We're inhaling through the nose, and I'd like for you to exhale through the mouth with a ha sound. Perfect. And then when you're ready, take it again. Move at your own pace. The idea is to have a long, smooth inhale through the nose, and a long, smooth exhale through the mouth. A couple more just like that at your own pace. So coming into breath work, in yoga we call it pranayama. This type of breath work we're doing right now works on the vagus nerve that I spoke about earlier. It's already starting to settle your parasympathetic nervous system. That's a good thing. That's a good thing. It's okay if your breath is choppy as you inhale. It's okay if your breath is choppy as you exhale. Again, we're not trying to fix anything. We're just noticing. All right, so now we're switching the breath. It's in and out through the nose, in and out through the nose. The idea is to balance out the length of your inhale with the length of your exhale. If you're congested in the nose, breathe through the mouth. It's okay. Never hold your breath, right? Especially those of us that are heart patients. You never hold your breath, never. And again, this is just about bringing awareness. Nice, Ash. Long, smooth inhale through the nose. Long, smooth exhale also through the nose. So we call this Ujjayi breath. It's an ocean breath. And so you think about the waves of the ocean, right? As soon as the waves come in, they're starting to go out again. And that's what I want you to sense in your breath. Nice. Good. And let's just open the eyes and relax here. Nice, you guys. So that's kind of how we start the class. We start by scanning the body. I try to throw in some breath work. Breath work can actually be anxiety causing to heart patients. I know what it's like to feel the right? If you're in any type of strange heartbeat scenario, I know what that feels like. Again, as we explore the breath work, it's not about fixing it. It's just about being aware and being comfortable with where your breath is tonight. Good. Let's just roll the shoulders. It doesn't have to look good. I just want it to feel good, right? So pull the elbows away up high. I feel my shoulders popping and cracking. Good. And let's reverse directions. Easy, easy. No rush. Again, it doesn't have to look good. It's just movement. Good. And then release the arms long. Good. Let's take our gaze over the right shoulder and bring your head to the center. Tuck your chin into the chest. A little neck therapy here. Good. Let's inhale, let the head rise. And then take your gaze over your left shoulder. And we'll come back to the center. Again, tuck the chin deep into the chest. And connecting with your inhale, let the head rise. Good. Let's take the right arm to the sky, drape it across your head. And now it's a tilt right ear to the right shoulder. You decide if any, how much pressure you're putting on that right hand. You don't have to put any, right? I know for me, the weight of my arm is enough. We're feeling a stretch right here through the left side of your neck, your throat, your chest, maybe even into the shoulder. Good. Let's release out of it. Reset the neck. Drop your chin to your chest. Lock it in. Inhale, let the head rise. Same idea on the other side. Take that left arm high, big stretch. Good. Drape it across your head, left ear, left shoulder. And just feel that beautiful stretch coming into the right side of your neck, your throat. Again, maybe moving into your pecs. These are some of the larger muscles that control the expansion of our chest and lungs. Good. Let's release out of it. Chin to the chest again. Reset that cervical spine, the bones of the neck. Good. Let's inhale, let the head rise. Let's take the right arm to the front and then across the body. Your right hand is reaching to the left wall. Good. Get a nice grip with your left hand. Pull that right arm deep into the body, extend and reach your right fingertips to the left wall. It is kind of like playing Twister, especially when we are on Zoom, right? So we're working on brain skills, listening skills too. Good, let's release out of it. Just kind of give the arms a shake, watch your surroundings, make sure you don't hit anything. And we'll take it on the other side, extend that left arm front, take it across the body, squeeze that left arm deep into the chest. Drop your left shoulder down. You probably set up with that shoulder creeping up toward the ear. Yeah, big stretch right there. Nice, you guys. Good. Then let's release out of it. Again, just give it a little shake and a wiggle, whatever you need to do here. Good. I'm moving to my chair. You guys stay where you are and we'll keep playing. Remember, that's all this is. It's play. That's it. Everybody good? Thumbs up? I lost some of you guys. Hang on. Let me see, where'd everybody go? There we go. I like that better. All right. All right, all right, all right. All right, so now as you're seated, I'd like you to kind of pull yourself away from the back of the chair. So we're not slouched like this, right? We continue to build that tall posture. Your tailbone is reaching down. The crown of your head is reaching high. Follow along. Your legs are neutral. I have some space in between my knees and I have some space in between my feet. Good, follow along. Let's roll the shoulders. Let's scoop the arms high. Get a big stretch overhead. Reach, reach, and then separate the arms. The hands find the chair. Drop forward onto your thighs. It doesn't matter to me how low you go. Good, let's inhale, rise back up to seated. Easy, easy, just like that. Let's roll the shoulders. And let's scoop it high, big stretch. Pull the rib cage out of the hips. Find the chair with your hands. Take a dive forward on top of your thighs. You are nice and safe holding onto the chair. Always inhale as you rise up. Good, let's take it one more time. Roll the shoulders, scoop it high. Let the hands touch. Find the chair, release forward on top of the legs. Stretching the crown of your head towards me. And let's inhale, lengthen, and rise on up. Good. So holding on to the chair. That's the thing about this class. You always have something to hold on to. Your chair. When we come to standing, we can still hold on to our chair. We can hold on to a dresser, a bed, a wall, whatever's around you. So your hands are on the chair here. Just extend and bend your right leg. Okay, so we're getting a little popping and cracking in that right knee. We are engaging the muscles of the right thigh. It's just movement. That's all it is. You don't have to look like my picture, right? Good, let's drop the right leg. Let's take it to the other side. Extend and bend the left leg. Fast or slow, it doesn't matter to me. Try to hang on to that tall spine. Nice, you guys. Let's release out of it. Again, we're seated tall. Reach down, get a good grip on your right leg. Let's just take some hip circles here. They can be fast or slow, big or small. It does not matter to me. And whatever we do clockwise, we need to do counterclockwise. So just take it the other way. Good, and let's just release that right leg down and just kind of kick the legs around. Give everything a little shake and a wiggle. Good, and we'll take it on the other side. Grabbing that left leg, reach down. You'll lose your posture as you reach down. Grab the leg, and it's just hip circles here. So moving clockwise, moving counterclockwise. There's no rush. Opening the hips. Really important. If you have a tight back, my guess is you have tight hips. Good, let's drop that left leg down. We're taking our feet wider here, out to the edges of your mat. We're moving through the same movement. The idea now is your belly and your chest can drop a little bit lower in between the legs. You're going to feel a stretch in the inner thighs. We're also working on range of motion through the hips, okay? Let's roll the shoulders and scoop it up. Hands touch. Find the chair. There is no rush. Holding onto the chair for support, hinging forward. You decide how low you want to go. Keep your head and your heart on the same level. Keep the breath flowing. Good. Let's inhale, lengthen, and rise up. Back to seated, back to our starting point. Let's take that 2 more times. Let's roll the shoulders and let's scoop it high. And then find the chair with your hands and release forward in between the legs. Travel slowly. There is no rush. Hinging forward in between the legs. And let's inhale, lengthen, and rise up. And let's take it again. Let's roll the shoulders and let's scoop high. And let's find the chair, releasing forward in between the legs. Good, and let's inhale, lengthen, and rise on up. Good, let's take our forearms to our thighs. We get to take a break here. Bring your fingers and thumbs together. Good, and just kind of drop your head to your place of comfort. You don't have to go too low with the head. Close your eyes. We take a break here, that's all. Couple rounds of breath. Good, when you're ready, opening the eyes. If they're closed, walk yourself up back to seated. Good. We're going to start adding in some twists. Keep them easy, easy. We're walking to the right. Walk to the right. Good. Take your hands to the chair. Little twist right here. Work on finding your place where you feel safe. Little twist. Your gaze and your shoulders are moving in the same direction. Good. Let's come out of it. Nice and easy. We'll take it to the other side. So walk around to the left. My back will be to you, but I'm still here. Hands to the back of your chair. Pull with your right hand. Push with your left hand. Take your gaze and your shoulders in the same direction. Good. Let's gently release out of it. Come back to the center. All right. We're going to start adding all these pieces together. Everybody okay? Thumbs up if you're with me. Ash, you good? Awesome. Good, good, good. All right, here we go. We're going to add on to this, okay? Your legs are neutral. If I was in class with you, I'd be checking to make sure your knee and your ankle were stacked, okay? We're seated away from the back of the chair, working on that nice tall spine. Good, here we go. Let's roll the shoulders and let's take it high. Your hands touch. Find the chair, release forward over your legs. No rush at all. The breath is flowing. Inhaling to rise, back to seated. Push through that right leg. Let's just hold it right here. Good, let's bring the forehead towards the knee. It may never get there, but get a little squeeze. Let your spine curve right there. Nice, you guys. Inhale, lengthen, and get tall and long again. And let's release that right leg down. You probably felt that right thigh really engaged there. That's the idea. Let's roll the shoulders and we'll scoop it up. So not only are we stretching, but we are building strength as well. Find the chair, release forward over the thighs, and let's inhale, lengthen, come on up. And let's push in that left heel, push, push, hold. Forehead towards the knee. Get a nice grip on your left shin. Think about drawing that knee towards the forehead. And when you're ready, let's get long again. It does not matter to me how high this left leg is. And let's drop it down. Good. Let's keep playing right there. Roll the shoulders and we'll scoop it high. Find the chair, release forward over your legs. Lead with the crown of your head. Imagine I have a string and I'm pulling your head towards me. Inhale, lengthen and rise. And let's push through that right heel. Push, push, hold. Same idea as before. Exhale, curve, forehead to the knee. Let's get long again. If your leg's getting tired, grab a hold of it. We're crossing our legs here. Cross your legs here. Bring that left foot a little bit more to the midline of your body. Your legs are crossed. Your right leg is on top. Perfect. Right hand to the chair. That's your safety right there. Take that left arm high. We're moving into a little bit of a twist. Release your left hand down to your lap. Take your gaze and your shoulders to the right. You decide how deep you want to twist. Good. Let's gently unwind to the center. We take a visit to the other side, to the left. Let's come back to the center. Let's ease this right ankle on top of the left thigh. So when I look down at my legs, it's sort of a triangle shape. It's sort of a figure four. This is going to be an intense stretch right here on the outside part of your right hip, traveling into your lower back. Again, tight hips, tight back, right? Holding onto the chair for support. Inhale, lift up, and then slowly hinge forward. You do not have to go very far to hear that hip talking to you a little bit, right? And we hang right here. Your breath is flowing. Good. Let's inhale, lengthen, and come on out. And let's just drop the right leg down for now. Just release it and let's shake the legs out. Good job, you guys. So we got to do it on the other side, right? If we don't do both sides, you will not sleep tonight. We have to be balanced, okay? So back to your starting point. You have space between your feet. You're nice and safe on your chair. Let's roll the shoulders and let's check it out on the other side. Take the arms high. Find the chair, release forward over the legs. With an inhale, you rise up. There is no rush. Push in that left heel and hold it. Forehead towards the knee. It may never get there, but that's the idea. Good. Let's get long and strong again. Long in the leg, long in the spine. Here we go. Grab the leg if you need to. Up and over. That left leg crosses. Perfect. Inch that right foot back to your midline. We're moving into our seated twist. Left hand goes to the chair. Your right arm goes to the sky. Good. You're twisting left. Little twist to the left. Perfect. Take your gaze and your shoulders with you to the left. Good. Let's come out of it through the center. Take a visit to the right. Good. Let's come back to the center. Here we go into that big hip opener. This is called a seated pigeon. Reach down and grab that ankle. Left ankle's on that right thigh. Wiggle around. Get comfortable here. Hands to the chair for support. Inhale, get long and tall. Create space right here in the hip sockets. Good. And then hinge forward. Find your stretch. Again, you will not have to go very far to feel that big, big, big sensation right there. Full breath. Good. With an inhale, let's lift up. And let's just release that left leg down. Let's take the feet wide to the edges of your mat. We take a break here. Forearms on your thighs. Fingers and thumbs touch. Close your eyes if you're comfortable. And just kind of sense how the body feels here, right? Maybe we've worked already. Maybe we've worked some kinks out, right? Maybe you slept a little bit funny last night. Maybe we're starting to get better alignment. Maybe your nerves are starting to settle a little bit. Nice, you guys. As you inhale, let's lift up and come out of it. Good. So oftentimes in yoga, we repeat the same posture multiple times so that we can, the first time you're learning what the shape looks like, the second and third time you can really take it a little bit deeper and get a little more involved if you want, okay? I want to walk the feet to the right. Yeah. Taking that same twist again. Hands are on the chair. As you set up here, your front hand, your left hand in this case, will be pulling and your right hand will be pushing, Okay, good. Your breath is full. You are not overdoing this twist at all. Good. Drop your shoulders. The breath is flowing. Beautiful. Let's gently release out of it. There's no rush. And we'll walk it around to the other side. So walk your feet around all the way to the left side of your chair. Hands go on the back of the chair. Your right hand pulls, your left hand pushes. Relax your shoulders. Continue to breathe. Good. Let's gently release out of it. Come back to the center. Take the feet wide, forearms on your thighs, fingers and thumbs touch. Drop your head if you want. Close your eyes if you want. You get a little recovery right here. How's everybody doing? Thumbs up? Everybody good? All right. Good, good, good. I'm moving my chair. You don't have to, but I am. So I'm still seated away from the back of my chair. I'm taking my feet wider than the chair. You see how I've got some space here? Good. We're working on the inner thighs here. We're working on moving our spine laterally as well from side to side, okay? Let's rest our hands on our thighs. You move at your own pace. You don't have to match my movement or the way that I'm calling the posture. Keep it safe for you, especially because we're not in the same room and I can't really assist you all. Hands are on the thighs. Just slowly move your right shoulder down to your left thigh. It's a diagonal stretch. It does not matter to me how low you go. You inhale to rise up, back to center, back to start. Good, take it the other way. Left shoulder moving towards the right thigh. It may never get there, but that's a diagonal stretch. Good, inhale and lift up. Let's take it one more time on each side. Right shoulder dropping to the left thigh. Inhaling to rise. Nice, you guys. We've got one more diagonal stretch right there. Left shoulder dropping to the right thigh. Nice, and let's inhale, rise back up. Perfect. Let's pull the feet together to neutral. I'd like for you to scoot all the way to the left side of your chair. Take your right hand to the chair. This is your safety right here. You are locked in right here with the right hand. Good. We're working the spine laterally. That means side to side. Let's take that left arm high. We're squeezing the knees together here. We are leaning to the right, side body stretch. Good. Let's inhale, come back to start. Release the hand down, shift over to the right. Just so you have enough room to get a solid grip in that left hand. Stability and safe always comes first in this class. Take the right arm high. Nice, Ash, you got it. We are stretching left here. Good, make sure you're breathing. Sometimes when we move, we hold our breath and we don't even know it. Let's inhale and rise up and out of it. Good, we will combine those two movements, all right? So we're back to wide feet here. Scoot away from the back of your chair. Hands are on your thighs. We'll take those diagonal dives down. Right shoulder moving to the left thigh. Inhaling to lift up. Left shoulder towards the right thigh. Inhaling to rise up. Good. Pull the feet together. We're shifting to the right. Your left hand is on the chair. Right arm goes high. Right arm high. You got it. And stretch left. Full breath. Maybe that right arm can get a little bit closer to your right ear. Maybe not. You may not have shoulder flexibility. And you might have tough time on the side that has been difficult for you. Let's inhale and rise up. And we'll take it on the other side. So scoot your bottom over to the left. Plenty of room for your right hand to stabilize you. Good. Inhale, take that left arm high. We're stretching to the right. Just think of all the space you are creating for beautiful full breath in the body. Good. And let's inhale and rise out of it. So still building on that. Back to moving away from the back of your chair. Feet go wide. We'll take those diagonal dips. I'm going to add onto it. And this is typically how the class goes. I introduce and show you all a couple of postures. I link them together. We repeat them maybe 1, 2, maybe even 3 times. And then we just keep building from there. Hands are on the thighs. We're taking those diagonal dips. You see how far you want to go. Don't push it if you don't want to. Inhale as you rise. Good. And then again, dipping down, left shoulder to the right thigh. Good, and let's inhale and rise up. All right, a little bit different this time. Let's keep our left hand on our thigh. Let's take the right arm high, and now we're tilting to the left. Some of you might be more comfortable with your left forearm on your thigh. You can play with that. I'd like for you to think about this right hip. Really keep it pushing down into the chair. Never holding your breath. Good. Let's inhale and rise up. And we'll take it to the other side. This is your extended side angle. Right hand on the thigh or your forearm. It's up to you. You got it, Nancy G. Take that left arm high. Let's find a stretch and a tilt right here. Pulling the rib cage out of the hips, creating space, creating mobility in the spine so your nervous system can work the way it's supposed to. Good. Let's come back to center. Good. Let's take a break here. Walk the feet in. Forearms on your thighs. Fingers and thumbs touch. Close your eyes. Drop your head only if you like. A couple rounds of breath right there. Good. When you're ready, open the eyes and just find your way up. Take support if you need it. Pull yourself up and maybe kind of give the legs. We do this a lot too. I always tell people kind of give it a shake and a wiggle, right? Because sometimes things get stuck. Everybody okay? Thumbs up. You can hear me and you're happy. Perfect. We're coming to standing. So let's just come to standing. I'd like for you to somehow have your chair like that. We'll be working facing the tall end of your chair. All right. Somebody's mic is on. All right, that's okay. So I'd like for you to be about 2 feet away from your chair. We're in mountain pose. So in mountain pose, your feet are slightly apart. Your hips, knees, and ankles are stacked. So it's not here and it's not here, okay? It's neutral. That's the whole idea. A couple feet away from your chair. Good, let's roll the shoulders just like we did when we were seated. Let's take the arms overhead, let the hands touch, soften the knees, find your chair, whatever your support is this afternoon. Good, maybe watch me first. Step the feet back, soften your knees and find a big stretch right here. Your head and your heart are on the same level, but I'm getting a huge stretch through my spine and along the sides of my body. Good, let's start to lift the head, lift the chest, carefully, slowly, walk the feet in. Make sure you're inhaling. Let's come to standing, nice and easy. Release your support if you are ready. Good, let's take it again. So this is a modified downward facing dog. So those of you that have yoga experience, the stretch is still the same. You're gonna feel a huge stretch in your hamstrings. If it's too much, you soften your knees. I know it's hard to tell in these pants, they're pretty baggy, but you soften your knees, okay? A couple feet away from the chair. You're in mountain. Here we go, let's roll the shoulders. We always roll the shoulders to expand and open the chest. Let the hands touch high, find the chair. There is no rush. Feel safe and supported in your chair. Step your feet back to your place of comfort. Your knees are soft. You decide how low you're going in this stretch. Feel the rib cage leaving the hips. Beautiful full breath. Good. Inhale, lift the head, lift the chest. Take your time. There's no rush. Take as many baby steps as you need to. Coming back to a nice upright position. Now, some of you may have felt a little dizzy there, so hold on to the chair if you need to and give yourself a moment. Take a big inhale and a big exhale. Good. I want to play with that one more time. I'm going to walk back just a tad. Let's roll the shoulders and let's scoop it up. The hands touch. Find the chair. Step it back. Find your stretch. This is a chair-assisted downward facing dog. So maybe each time you come into this, maybe you're getting a little more comfortable. Your body's getting used to the idea. You know, there is such a thing as muscle memory. Beautiful, you guys. As you're ready, lift the head, lift the chest. You decide how fast or how slow you're moving inwards. Moving back to your upright position to mountain. Releasing the chair when you're ready. And just taking a couple moments right here. Good. Everybody good? Thumbs up? So some of you may have felt that sort of dizziness, right? As we stepped in and out, lowered the head a bit. So keep in mind, if you find that that really made you dizzy, always try to imagine and feel like your head and your heart are on the same level, and that will help with that. If you're dropping your head lower than your heart, you probably will have some dizziness. All right, good. So holding on to your chair, your dresser, your desk, your table, whatever you have, let's just work the feet a little bit. So you're lifting the heels, maybe one at a time, maybe both at the same time. working through the feet. So slide your weight back into your heels, lift your toes up. You can do this with shoes or without shoes. Back and forth, a little rock and roll. So I feel a lot of popping, a lot of cracking, a lot of readjusting. I don't feel any pain. Again, even in my feet, we have so many bones and so many layers of tissue. It's just kind of nice to get through all of that, right? I know sometimes we get cramps in the arches. So just kind of play with that. All righty, we're gonna, let's see. Yeah, we're gonna play with a standing balance, okay? It's tree. We're gonna keep it nice and supported. I'll talk you through it. Balance is one of the things that it only stays with us if we practice it, right? And I encourage my students to do this in line at the grocery store, waiting for an elevator, making lunch, in church, wherever you are. Play with shifting your weight from one side to the other. You know, there's a lot that happens in a standing balance. So let's have your left hand on your support, whatever that is for you. So very traditional tree. There's lots of levels and layers to this. I'm going to start everyone super, super basic. Shift your weight onto your left leg. That's your support right there. Let's take the right hand to the hip. Your right foot comes in right about here. You can have a kickstand if you want. So I still have some weight on this leg. The majority of the weight is on my left leg. You decide. Those of you that have practiced before, you can start to ease that right foot up anywhere on the inside of your left leg. It's up to you. Good. You can play if you want, and this is all it is playful. You can try to take your left hand off your support, both hands to the hip. Right? So remember, your chair is here if you need it. You can tap out, have a sense of humor. When we play with standing balance, it's playful. That's the idea. I want it to feel childlike, but I want you to feel and sense how much work is happening in the left leg right now. Your left foot, toes, and ankles are moving and grooving and crunching, and some people feel tightness in their arches here. That's what we want. When you've had enough, relax out of it and kind of kick the legs around. Keep your chair where it is. I'm just moving this way so you can see me again. So the idea with your base foot moving and grooving like that, you are creating strength. So when you step off a curb and your ankle goes like this, you kind of already stretched and you kind of already started to build strength in those ligaments and tendons in the ankle. We want that. So again, as we play with standing balance, it's your supporting leg that's going to rock and roll. I'm exaggerating here, but this is kind of what it's going to feel like. And again, it doesn't matter if you have a shoe on or not, okay? Right hand is on the chair. Your right leg, this is tree. So think of your right leg as a tree trunk, right? So you're grounded. You have roots in that right foot really connecting you to the earth. Good. When you're ready, find your placement for your left foot. See what you like. Maybe a little kickstand. Maybe this side's a little wobbly. Keep it here, nice and supported. Left hand is on your hip if you like. Get the legs organized and then see about maybe taking that right hand off your support. You will find very quickly which side you have better balance on. You are breathing. Sometimes when we come into balance, we lock our breath. No, you want to have a continuous flow of breath in and out of the body. Nice, you guys, good. Let's relax out of it. I always like to kind of kick the legs around, give the hips a little rolling around. I want to take it one more time on each side. You guys keep your chair where it is. I'm just moving so we can see. Your left leg is your support. So we're going to build tree the same way we did before in the lower half of your body. We're going to play a little bit differently with the arms, okay? So it'll be more of a challenge, but as always, your chair is here if you need it, okay? Shift your weight onto your left leg, setting up your tree. See what you like. I'm going to give you choices here. Maybe you bring the hands to prayer position. That's choice one. Or maybe the arms go overhead. See what you think. Remember, a tree, the upper part of a tree is always moving, right? So don't fight that sensation. Let your upper body rock and roll a little bit. It's the lower half of your body, especially that left leg. It's keeping you really grounded and connected to the earth. Continue to breathe. Nice, you guys. When you've had enough, you drop out of it. If you just got into your groove, stay there. Don't ever make me rush you out of a posture. Good. You got one more standing balance. All right. So your right hand is on your support. Your right leg, that's your tree trunk, nice and grounded. Again, really imagine you've got roots coming out of that right foot. Find your placement for your left foot, see what you like. Get all of this organized down below. Two choices with the arms here. Prayer position at the heart or overhead. Totally up to you, see what you like. And just notice how different this feels than the first side, right? Maybe a little more challenging, maybe a little more solid. It's always good to know what's happening in the body. Nice. When you've had enough, just drop that leg down, or if you're feeling really good right now, stay where you are. And again, we just kind of shake and wiggle here. Beautiful job, you guys. Really nice. So typically, in a class, it kind of flows the way it has so far. We spend a little more time in the chair, we do a little bit more standing, and then we come to the floor and we finish the class on the floor. I'm not really sure about everyone's surroundings. Can you guys come down to the floor? Are you able to do that or not so much? I just am not sure what everybody's got going on at home. We'll skip the floor. We'll skip the floor. I don't know that everybody's up for it. All right, so let's do this. Come back to seated, wherever, really sort of wherever you started the class. I just want you to be comfortable here. So this is relaxation. Typically, this would be at the end of the class. And again, today I was just giving you a little bit of a mini class. So the beginning of the class, we start with centering and finding some awareness. At the end of the class, we really try to tap into deeper relaxation. Good. So I just want you to get comfortable here, much like you did at the start of the class. And get to a place where all the wiggling stops, okay? And close your eyes. Good, just close your eyes. And again, that was a mini practice, but I'm hoping you can tap into that idea maybe of your heart rate maybe came up a little bit. It's all good. Your muscles, especially your thighs, might feel like they've done a little work, which is also good. You know, yoga is weight bearing, so it can help build stronger bones. And the beauty of it, I think, is that, you know, we are using our own body weight. We're not using weights or machines. Good. So as you're here, again, you're just coming to that place where you are nice and settled. Let's have the palms facing up wherever you are. On your lap. On your lap. Amy, just drop them down. Yeah, perfect. Here's the idea. When your palms are facing up, you are open and receptive. Okay. So open and receptive. So as you're here, really think about bringing positivity into the body, okay? On your exhale, anything negative is leaving the body. So it's a little bit of cleaning house. There's an exchange that's happening. Again, as you inhale, you are pulling in the good stuff, whatever you need today. And on the exhale, you are releasing things you can't control, anything you're worried about, any stress, any anxieties, and any worries. So just allow that exchange to happen for a few more rounds of breath. Bring the hands to the heart in prayer position. Your thumbs are actively pressing into the chest. I think it's very important for those of us that are heart patients. Connect with your chest here. Connect with the rise and the fall of your chest as you breathe. Some of us may even sense the beating of our hearts, right? And I know sometimes as heart patients, we don't really want to connect with that, but just make a connection here. Again, your thumbs are pressing deep into the chest. And as you're here, these are the words that I always use when I close all of our classes. So your thumbs are making that connection to the chest, to the heart. And as you're here, allow yourself to come into a place of more health and more healing. A reminder to move through every day with more grace and more gratitude, a greater sense of humility, a greater sense of compassion, and a greater sense of kindness. Just take a moment here, make this practice your own. I'd like for you to take a moment and connect with one thing for which you are grateful. Let's raise our thumbs to our foreheads. Give yourself a press. We'll draw the hands back to the heart. And when you're ready, just gently opening the eyes. There's no rush. We close our class by saying namaste. So namaste, all of you. Namaste has many, many, many definitions. It's kind of like saying peace to everyone. It's wishing well to everyone. My own personal favorite translation is that the divine in me recognizes the divine in you. But anyway, it is a way of wishing well and peace and healing to everybody. So thank you so much, you guys. You did a great job. I really appreciate you being open to participating. I'm happy to answer any questions if you all have any, but you guys moved great. Guys and gals, I should say. I always say guys collectively, you know, but Nancy, you're included.
And also Amy.
Yeah, and Amy too, right?
Yes, that was fabulous, Karen.
Good.
That was almost like a full class. I had no idea you were going to do
Almost.
this.
Almost.
I got my bonus class
Yeah, you
today.
did.
Karen, it was a good class.
How did everybody feel? Any feedback from the new people? I would love to kind of get your take or your worries or your concerns, or what'd you think? Ash, any feedback?
Well, I feel very good. I do this some of things myself. Today I feel much better.
Good.
Yeah.
Okay,
Good.
feel much better.
And the goal is, you know, maybe you come in like this and I want you to leave like this, right? More
Yes.
open, more expanded, space in the spine, space in the body. So you're getting these beautiful breaths and really, you know, especially as heart patients, we really need to nurture ourselves in that way, right? It's kind of subtle, but it's not really subtle. Like it feels simple, but it's actually, it can be complicated. So good, Ash, that's great. Anybody else? Yeah, Amy.
I have one question. So there are two things. So say I usually do this sometimes at home after work by myself, you know, stick my iPad on and pull up some moves. So the two things I always do, I crunch my spine down and I forget to breathe. Are there any tips you have to give yourself a reminder to sit up and breathe when we don't have you here helping us?
Right. Well, exactly. I think, you know, Amy, probably what you're doing is perfect, right? You're instilling an awareness. Or maybe my students over the years I've heard them say this, that they hear my voice in their head, which I don't know if that's a good thing or not, but awareness is everything, right? I'm with you, you guys. I started a new job a year ago. I am like this all day long. So just take a moment, roll the shoulders. That's all you got to do. Think about it, because it does change how much oxygen you're bringing into the body, and it can affect your emotions. It can affect obviously your health. It can affect your digestion, all kinds of stuff. So I don't know, Apple Watch, there might be, Jeffrey, you might know this, but there might be some app or something on here. I know there's like a meditation thing that reminds me when to breathe. So maybe,
Yes.
you know, if you are into technology, I'm sure there's plenty of apps you could
Right.
do.
If you have an Apple phone or if you have an Apple Watch, you can subscribe to Apple Fitness Plus. They have yoga classes there. And of course, strength training, all kinds of stuff, dance moves, you know, but as far as for heart patients, I haven't seen anything. The good part about it is when you do participate, all the biometrics from the watch are on the screen of your television. So you know your heart rate,
cool.
you know all about everything. So it's pretty cool. Yeah, it's pretty cool. Karen, you did a fabulous job.
Oh, good. Thank you. Thank you.
Yes.
But back to your question, I just think, you know, even you all that are in attendance today, maybe tomorrow when you're at work, and I don't know how many of you are working at home. Well, it doesn't matter. If you're working at home, you're still probably hunched over reading or typing. You know, think about it. Just like, just set it up differently, you know, and your body will thank you for it. And your stress level will thank you for it too. And it takes a while. What is it? I think it takes 2 weeks to create a new habit. So just, I think awareness is the first thing. Yeah.
Yeah, I want to thank everybody who let me use your video. You're going to be stars in our 6th educational video.
Fabulous. Thank you, Jeff. I think I'm going to put sticky notes in my new office. I have like a cabinet right there. I'm going to put a big pink, bright pink sticky note. Sit up and breathe.
Yeah.
Karen, this is Linda. Hi, good to see you.
Hi.
This is my very first yoga class, and hopefully it will not be my last one.
Oh, good. Is this Linda Douglas?
Yes.
Oh, hey.
All
How
right.
did you feel?
Fantastic.
I can't see you, Linda, but how did you feel?
You know, and some of the moves there were, I could feel a little tightness, but you know, I have, you know, like a lot of us, aches and pains, and so
Yeah.
just have to work through that. And I think this yoga will be helpful for that.
Well, thank you for trying it. And yeah, I mean, this whole aging thing is for the birds, right? Forget about being a heart patient on top of it. You know, just move, you guys, just move. Walking is enough. Sitting in your chair and stretching is enough. I mean, that's the key. That's the key. I'm glad you enjoyed it, Linda.
I truly did.
Perfect. Good. Brian, did you move a little bit with us? Can't hear you.
Unmute.
He can't. I don't think.
How about now?
Oh,
Oh,
okay.
yep,
okay.
now we can hear you.
Okay.
Now we
Did you
Yeah,
move?
actually I did.
Oh,
Now
good.
my question is, I had back surgery a few years also.
Yeah.
So I had very little balance. Is there
Yeah.
anything I can do to kind of help with the balance part?
I mean, balance is something that has to be repeated multiple times a day. Again, if you are in the grocery store at Giant or whatever, shift your weight onto one leg. See if you can just kind of hang out there. Shift your weight onto another leg. I mean, it's really practice. When you're cooking dinner tonight at the stove or at the microwave or whatever, shift your weight from side to side. You got to play with it. What was your back
Okay.
surgery? Did you have a fusion or what did you have done?
L4, L5 fusion.
Gotcha. But that you know, that really should not affect your ability to balance. If anything, that gives you more of a straighter rod, if you will, to help you find it. So I think it's more about muscles in your legs getting stronger, and
Okay.
also, you know, balance is very much about your inner ear too. So people that have, you know, ear infections or whatever, sinus infections, your balance goes out of whack. But balance, you have to do it, you know, every day you're brushing your teeth, shift your weight from one leg to the other. You got to play with
Okay.
it. Yeah.
All right. Thank you.
You're welcome. I'm glad you gave it a go.
So
Not a
Karen,
Yes,
Karen,
Jack.
can yoga help in maintaining our blood pressure?
Sure, it can. Yeah, you know, this kind of goes back to what I was talking about before, and I didn't want to get too much into the nervous system, but we have a sympathetic nervous system and a parasympathetic nervous system. Your sympathetic nervous system wants to amp us up, right? Gets us excited, gets us stressed out, gets us on that wheel of stress, and that's going to increase your pressure. Parasympathetic nervous system we're affecting with our breath work. Really, that's it. Remember, yoga started over 5,000 years ago, obviously in India, but initially there wasn't this movement around. That has all happened as it's come west. True yoga is sitting in silence, really working on the brain and on the breath. All those movements came in much later. So that is the belief behind a lot of Eastern thought, that that's how powerful the breath is. So the breath, if we tap into it, you know, even just do a big inhale, exhale every hour, it will trigger that parasympathetic nervous system that will start to settle things. And I believe, and there are documents, you know, research that has been done, that it will help to settle and help to sort of nurture the high blood pressure situation.
So I can't help but say this. Please allow me to say it. When I opened my eyes from open heart surgery in November of 2015, my accredited visitor was Karen. Now, who would have ever thought all these years later, and I became an accredited visitor at Suburban as well, but who would have ever thought all these years later, here we are in Zoom together.
But strange, I forgot, Jeffrey, you and I were there almost the same time. What week were you
Well,
there?
When November 23rd, it was Thanksgiving in 2015.
Oh my gosh,
when
I
had
was
surgery.
there. I was there just a few days before, from the 19th. Isn't that funny? Yeah, just down the
Right.
hall.
Well,
Right.
Dr. Horvath was my surgeon
Yeah.
at the time. He's no longer there.
No.
Nancy, who was your surgeon? Do you remember?
So I had the, well, I didn't have actual surgery. I had stents
Oh,
put in.
Okay.
Yeah. So I had the interventionalist, whatever the word is. What?
That's the right word, Nancy. You got it.
I
That's
got
the
it?
right. interventional cardiologists.
Yes, that one.
They're plumbers, and the guys who put in pacemakers, electrophysiologists,
Right.
are electricians. So we have plumbers and electricians for hearts.
It's as simple as that. Simple as that.
Thanks, Amy. Thanks for that.
And Mr.
That is
Adams, how
funny.
did you feel tonight? Mr. Adams, I don't know your first name. Can you still hear me? Can you hear me? How'd you feel? I saw you moving with us. Can't hear you.
Well,
Must be
muted.
muted.
Here we go. Nice to meet you. How'd you feel tonight? You're still muted. Or I can't hear him. Can you guys hear him?
No,
Mm-mm.
well, Mr. Adams is a tower patient.
ah,
Cool.
The
Great.
tower patient, yes. He came to us to the unknowns. He called me one day. I connected with him.
excellent. Well, I'm happy you're here, Mr. Adams.
Yes.
Very happy.
Me too. You looked great moving around. I hope you enjoyed it. Any other questions
Well,
or anything else? Anybody want to share or talk about anything?
okay. Well, Karen, thank you. This was
My pleasure.
fabulous. I feel like a new woman. I am going to
Good.
go out and conquer all this week now. And remember to breathe and sit up.
That's it.